In the first year of a baby's life, they will see a pediatrician at least 7 times. That same newborn's mother will only see her physician once, and that's at her 6-week follow-up appointment if the overwhelmed mother remembers to schedule it. Today, I will discuss the Black maternal health crisis in America. If you're a woman in this country, especially a Black woman, your odds of dying during childbirth are 3 to 4 times higher than average in our country. I am a Black woman. I am 3 to 4 times more likely to die during childbirth than my white counterparts. Why is this? Systemic racism and implicit bias. Doctors seem to forget the oath that they take. That requires a new physician to swear upon a number of healing gods that he will uphold a number of professional, ethical standards. Next year, I turn 18 years old. At 18 years old, I will be legally responsible for all of my medical decisions. 18-year-olds have babies every day in this country. Pregnancy, birth, and the attempt at motherhood should not be a death sentence. But in this country, if you're Black, your hospital staff is less likely to treat you the same way as the white woman down the hall. It's not her fault that she will likely survive her delivery. The system is designed for her. This photo is of my mom and me. She gave birth 3 times. 2 of those pregnancies were high risk due to preeclampsia. My mother was fortunate enough to birth with midwives and an obstetrician who closely monitored her condition. The many unfair policies and unjust laws have restricted the rights of Black families for generations. It is important that this is understood. The Tuskegee Study of untreated syphilis in the Black man started in 1932. 400 test subjects were intentionally given syphilis. In 1951, Henrietta Lacks, a married mother of 5, was being treated for cervical cancer when it was discovered that her cells were immortal. She was treated like a human guinea pig, and her cells were taken without her permission. Unfair practices like these still happen today. We must change this now. How do we do it? Legislation. The Black Maternal Health Momnibus Act includes 13 individual bills. These bills were initiated by Congresswoman Alma Adams, Lauren Underwood, and the Black Maternal Health Caucus. When bills like this are in place, all women will benefit from it, not just white women or Black women. Our medical system is not created with equity in mind. So how do we combat it? We fight racism in the healthcare system, diversify the workforce, we give more care given to moms in the first year to help combat postpartum depression, and we use certified professional midwives, nurses, and doulas. According to the Associated Press article written by Kate Stafford entitled, "Why Do Black Women Die During Pregnancy?" she clearly states that doctors don't take Black women seriously. The CDC says that Black women had a maternal mortality rate of 69.9 deaths per 100,000 live births in 2021, which is the highest in the country. It's also 3 to 5 times higher than the rate for white women, regardless of education or socioeconomic status. Now, I don't plan on having a child anytime soon, but when the time comes, the statistics for my survival aren't great. Here in Palm Beach County, I am 11 times more likely to die during labor or the 4th trimester. Yes, I didn't know there was a 4th trimester either. What can moms do on the immediate level? They could find a caregiver they trust, hire a doula, ask questions and be informed, or move on if they feel mistreated and report malpractice. Dr. Monique Rainford, the author of Pregnant While Black, Advancing Justice for Maternal Health in America, stated, "It's not their fault. It's not because they aren't doing the right thing. The problem is way bigger than them." Remember these names so that we don't have to keep adding to the list. You may not recognize the names of these women, but they were important to parts of their families, and their absence can never be replaced. Shanice Wallace, MD. Kira Johnson. Tori Bowie. Sharmani Gibson. Amber Rose Isaac. and Christine Fields. These are just a few of the thousands of Black women we have lost in this country. There should not be any more. Our lives matter. Thank you.